If you're suffering from a cervical radiculopathy, here are 4 tips that you can do to try to reduce your symptoms. Now, of course, before you begin any of these, make sure you're okay and you're cleared by your doctor or your healthcare provider. The first thing we're going to do are seated retractions, cervical retractions with side bending to the side that you're having your symptoms on. The trick with this is to stay retracted with your head pushed back the whole time you're going through this movement. So Kenzie's going to retract and then she's going to side bend to the right. We're saying for the sake of this video that she's having symptoms down her right arm and into her right hand. And so she would repeat that somewhere between 5 to 10 repetitions, 4 to 5 times a day. Just really as much as she can tolerate. If she can't bend over as far, then she would just go as far as she can go to eventually trying to bring her ear over towards her shoulder. The next thing we're going to do are 4-way isometrics. She has her hands behind her head. She's going to push straight back, initially with low intensity, not pushing very hard, and then progressing from there as she can tolerate. And she's going all the way around each side and then forwards, holding those contractions for 1 to 3 seconds, and she's going to repeat that somewhere between 5 to 10 repetitions a few times a day. Next, we're going to do nerve flossing. Again, we're going to say that the symptoms are going down her right arm. And so this nerve floss technique here, she just has her hand in her head in this position, and then she goes out, and then she just comes right back. She's going to complete maybe somewhere between 5 to 10 repetitions of this, again, several times a day. Lastly, she's going to perform a self-traction technique. I really like this technique, especially if you have a pillowcase at home. If you don't have anyone to do this with you at home and assist, you can do it with yourself or to yourself. So she has a pillowcase. It's hooked just under the base of her skull here under her occiput. And you see the direction she's pulling. She's kind of pulling this pillowcase up through about the angle of her eyes. And then she just pulls up and then relaxes. If you have trouble gripping or you have too much pain in your arm or your hand or numbness, this would be difficult. You're going to want to get someone to help you if you have someone. But if not, if you can do this for yourself, you just pull up till you feel a nice stretch there. You'll hold that somewhere between 3 to 5 seconds and then just relax and then repeat it. And you would do this movement several times a day. We hope this video helps, guys, and thanks so much for watching.